and it was like this hard, reddish, purplish, just like my whole calf. Like, oh, I can't explain it. Blood everywhere. My actual pinky toe was like crooked. Whole toenail came off. I did everything I could to keep it clean. Band-aid, da-da-da. Like, I did everything. I did a lot of research. Like, I woke up the next day, my whole bottom of my leg was super red, like hot. And I knew exactly what it was. I knew exactly what it was right off the bat. Cellulitis. Because I get that out right now. There is no lying in this video. So we're gonna start with the fact that when I got into the doctor's office, I am losing a lot of circulation in that leg. How I sit, how I sleep, just how I do things. Obviously, I was diagnosed with depression. That is a given. I mean, I've known since I was 9 years old. That is when I was first diagnosed with depression. That hasn't changed, although I was diagnosed with anxiety/panic disorder. Obviously, I struggle with so much anxiety. I am bipolar. I have known for a very long time without actually being diagnosed that I am bipolar, and for someone to finally tell me that. I went to the hospital because my heart was beating irregularly. The EKG was a little funky, clearly. As for my legs and feet, they're swollen. My legs have always been like that. I'm just gonna assume it's like fluid, or just some fat people have bigger legs. Like, what can I say? I don't know what I did. I honestly can't tell you. But I pulled my back somehow, or twisted my back somehow, and all of a sudden I couldn't stand straight. I just noticed every time I tried to sit up a little, the pain was a lot worse, and now every time I bend it's a lot worse. So it really seems like it's a hernia. I don't know. I was enduring the pain and trying to ignore it, and I woke up today. Not only does it hurt a little bit worse, but now this is like TMI, but hi, Amberlynn is trying to be honest with you guys. As soon as it's Monday, like literally I am going to call my doctor's office, make an appointment for as early as possible, as soon as possible. And what am I eating? I'm pretty much eating whatever I want. So I have some wisdom tooth situation going on. I have a full-fledged toothache, all of these teeth, or like 6 different people like that work there from like 6 different areas just like came, cleaned up the floor real quickly. I started crying because I was scared. Like, I've never had anything like that happen. It was like blood was just everywhere. It felt like someone literally took my invisible oxygen cord of life and completely cut it off. I was choking on a very big piece of potato that I literally didn't chew. She was trying to get behind me, and I actually all the food ended up spilling all over the floor, like my seafood boil. I literally would have died without her control of my bowels, and I pooped my pants. I got my results back, and I do have cancer. I have womb cancer. And so it's uterine cancer. And I know it's my fault. Undiagnosed with BPD, I would go through the lengths of doing these tiny little lies just to prevent people from like leaving my life. And that is something with BPD that they do. Because I need people to know that like mental things it's scary. Like, with my journey, my story, my eating disorder, the way that I do things around here, they're completely 2 different things. But it wasn't because we were in the car. It's just I'm having a lot of anxiety, and I don't know, a lot of tears. I have been back on my mood stabilizer. I think it's been about 2 weeks, and I already feel so much better on it. Honestly, I was diagnosed with depression my whole life, and now that I was diagnosed being bipolar, which was the right diagnosis, it has honestly changed my life, because I looked at my leg and she listened to my symptoms. She was like, this is not a blood clot. This is not a blood clot. And so it turns out that I am losing a lot of circulation in that leg. How I sit, how I sleep, just how I do things. And she explained the reason why when I stand or when I walk, that's why I don't feel pain anymore, which I've with my bladder infection, and then it doesn't travel to my kidneys because we don't need that right now. We really don't. I have a very bad vitamin D deficiency. I am anemic. I know exactly what's causing it. My voice sounds like normally my gallstone attacks last no longer than 10 minutes and they hurt really bad. But yesterday I woke up with a gallstone attack that I have never felt before. It was on my so bad. I was prescribed an SSRI to help with my anxiety, my lows, my depression, and to help with the deep feelings of having BPD. Turns out I do have hernia, folks. Obviously, I do have lipedema and lymphedema. I have mental illness, but I guess now is not like out of the diagnoses I've got my whole life ever since I was 9, which I was 9 and diagnosed with depression for the first time because like I was in foster care and just no 9-year-old should ever be diagnosed with that. But since then, I've been diagnosed with OCD, I've been diagnosed with PTSD, bipolar, and those things were like so much easier for me to accept. Diagnosed on my 19th session with my psychologist with borderline personality disorder. In 19, I started forming this big fluid like this on my leg. I don't really know how to explain it. Anyway, but I take my Zoloft. Yes, I am on the Zoloft. Went for a walk. I don't know, my headspace is just not the greatest lately. And it's like I'm so confused. I was loving vlogging, but now I'm in a low. So it's like vlogging just, I don't know, I just feel so disconnected. Falling. I looked down at the ankle that made that noise and my foot was just like dangling.
Hello, hello. I'm just messing with you guys. Anyways, it's me, Chelsea, and I'm back. In today's episode, I want to continue my discussion about Amberlynn Reid and why the internet seems to hate her so much. To be more specific, I want to take a look at what I believe to be a case of Munchausen's and perhaps even a touch of Munchausen's by proxy. So to get this out of the way a little bit, if you don't know what Munchausen's is, Munchausen Syndrome to be precise, it's a facetious disorder that it's marked by an individual who, for lack of a better way of saying it, pretends to have different diseases, different ailments, different problems going on in order to gain attention and sympathy. These are people who, anytime they feel like they're not getting the attention that they need in their lives, suddenly they have different illnesses. And this can range from minor to terminal diseases. Some people are known to have faked cancers for the attention. Does that sound familiar, Boogie? Mm-hmm. But we're not talking about people who are just narcissistic and trying to get attention on the internet. We're talking about a real rare disorder. Of course, I don't really think it's that rare. In fact, I would argue that it's far more common than experts believe, and it just goes undetected because a lot of people travel under the radar with Munchausen's, with the people in their lives not even realizing that's what's going on. Some people just get brushed off as being, quote, hypochondriacs. And a lot of people actually succeed in manipulating others into believing that they actually are sick all the time. In the case of Amberlynn Reid, I believe that she has possibly lived a whole lifetime of manipulating people and flying under the radar as somebody with Munchausen's. Of course, I'm no expert and I'm not trying to diagnose her here. I'm just making some observations. Anyway, Munchausen syndrome presents the following behavioral symptoms. We have fabricating symptoms, which is when the person claims to have illnesses that are hard to disprove, such as severe pain, headaches, fevers, chills, the general symptoms that you can't really test away. You know what I'm saying? Like stomach aches, things like that. Self-inflicted injury. If a person's creating their own injuries, cutting, infecting themselves by rubbing dirt into the wound, or maybe refusing to bathe after putting their leg inside of a dirty mud puddle and giving themselves cellulitis. Maybe I'm being petty by saying that. Anyways, people with Munchausen's tend to tamper with their tests, manipulate samples, They've been known to add blood or bacteria to their urine samples, tampering with medical devices like thermometers, or like scales, such as throwing off how much the scale will say how much they weigh. They might change that. People with Munchausen's tend to have very extensive medical histories. And again, I'm reading this off a list of the behavioral symptoms, so bear with me. People with Munchausen's tend to be hospitalized frequently. They travel between different doctors and cities to, hospital hopping. Kind of what Steve Asante did on 600 Pound Life when he was doctor hopping to get meds. But that was more of a drug addiction situation. People with Munchausen's tend to know a lot about medicine. As far as the Google symptoms list goes, they're saying medical sophistication, and that's somebody who has in-depth knowledge or an apparent in-depth knowledge of medicine. Somebody who sits around and does a lot of medical research on the internet and tends to think that they know more than doctors is a pretty good example of that. These people tend to have disruptive behaviors that make them difficult patients as well. They also have dramatic histories and vague histories where stories maybe don't line up or make a lot of sense. And when we're talking about our Goral here, that's pretty frequent as well. Of course, the overall main symptom or quote behavioral symptom of Munchausen syndrome is just basically using medical situations, medical emergencies, sickness, illness for umbrella excuses over everything in their lives. It's a very common practice that they do. Like, I'm not trying to really over illustrate here, but in my opinion, a good example of this would be Amber having constant kidney stone pain that makes it to where she can't come to work, suspiciously after having altercations with coworkers where they get one up over her. You know what I'm saying? In other words, it's very common for somebody with Munchausen syndrome to mimic and pretend to have illnesses that are hard to confirm, hard to prove, and hard to do anything about. Really anything surrounding abdominal pain, nausea, headaches, fevers, things like that. Kidney stones is indeed a big one with the Munchausen's. And aside from Munchausen syndrome, there's something a little bit more dangerous than Munchausen's itself, and that's Munchausen's by proxy. Now it's more commonly known as facetious disorder imposed on another, acronym FDIA. I prefer to just call it Munchausen syndrome by proxy because, that's just what it's always been called. That's what I know it to be. And in my history of researching true crime history and covering crime cases, that's just always what it's been referred to. So that's what I'm going to call it in this video. In Munchausen syndrome by proxy, instead of the person pretending to have various illnesses and ailments in order to get sympathy and attention, they use the perceived ailments, injuries, and illnesses of another person in order to gain the attention as a savior, a hero, a healer, or just general sympathy for being a person who's in close proximity to another who is suffering from these various ailments, illnesses, etc. What makes this more dangerous than just Munchausen syndrome is the fact that most of the time it involves a child who is being exploited and abused in order to be pushed off as somebody with an illness for the parent to receive the praise, the sympathy, and the attention. Munchausen syndrome by proxy is an insidious, dark form of child abuse, but it doesn't always have to involve children. It can involve any vulnerable individual. Not only can it involve children, such as infants and older children, it can involve people who suffer from various diseases that leave them incapacitated or unable to make their own decisions. It can involve elderly people. It can involve pets as well. I think one famous case of Munchausen syndrome by proxy could be the situation surrounding Gypsy Rose and her mother, and we know what happened there. Aside from Gypsy Rose Blanchard's story, there are actually countless stories in recent years, actually, involving Munchausen's and Munchausen's by proxy. Hannah Milbrandt was a child that was convinced by her parents that she had terminal cancer. She was used for donations. Her parents collected money, sympathy, etc. She never had cancer. In 2022, I think, Kelly Turner Grant was convicted of murdering her own daughter, who was 7 years old. Not only did she pretend that her 7-year-old daughter was sick, but she put her through countless unnecessary surgeries and medical procedures, which included installing and uninstalling feeding tubes in the child that didn't even need it. And oh, by the way, honey, if you think Munchausen's by proxy is limited to just bad parents and people who abuse elderly or vulnerable people that are just in their care, we're not just talking about individuals. We're talking about people who are trusted in the medical profession as well. There are several nurses in the medical profession that have been arrested, convicted, sentenced, etc., as serial killers due to them having Munchausen syndrome by proxy. Some famous serial killer names in the medical field with Munchausen's by proxy include Lucy Letby, Janine Jones, Beverly Allett, Bobby Sue Dudley, and I'm sure the list can keep going, but I'm not going to keep looking. These are people who are entrusted to care for the sick, the young, newborn babies, and people lost lives. All because some of these nurses, as I mentioned, needed to be seen as saviors, needed to be seen as healers, needed to be seen as heroes. And they lost patients as a result of this because they were making them sick on purpose in order to, quote, heal them and be, viewed as these heroes. But they weren't. They're not heroes. They're very sick individuals who hurt others, which is really fucking twisted because the entire motives behind all of their diabolical actions is so they can be loved and seen by others as good people, as helpful people, like I said, as heroes and saviors. And sometimes as victims and as survivors. It's crazy. And it's the kind of crazy that there's no medication for. In fact, Munchausen's and Munchausen's by proxy are two of the hardest to treat mental and behavioral disorders due to the fact that the people who suffer from it will always refuse to admit that they have it. It's one of the primary behavioral symptoms of these disorders. Is a complete and total refusal to acknowledge that they even have it. They're aware that they're faking these things, okay? And to a point to where it becomes a pathological situation. But to admit something that you have pathologically come to believe is close to impossible, especially when you're doing it as a means of intense and extreme manipulation. And to make matters worse, people with Munchausen syndrome and Munchausen syndrome by proxy tend to present a high rate of psychiatric and behavioral comorbidities. And that's kind of a hard word to say, comorbidities. And basically what it is a list of other psychiatric conditions, disorders, syndromes that are diagnosed alongside initial diagnosis or a primary diagnosis. So some common comorbidities that are diagnosed alongside Munchausen's and Munchausen's by proxy include borderline personality disorder, depression, and substance abuse. So anyways, let's bring it back. How does all of this relate to Amberlynn Reid? I mean, if you're a part of Gore World, if you've been watching this woman for any amount of time, and if you're aware of any of her lore, I'm sure you're kind of picking up what I'm putting down. Over the years that Amberlynn Reid has been on the internet, she has made claims of having multiple conditions, ailments, injuries, disorders, syndromes, diseases. She's also quite possibly exaggerated a number of the conditions that she is said to have legitimately had. Cellulitis, lipedema, lymphedema, BED, bipolar disorder, borderline personality disorder, asthma, athlete's foot, a dangling ankle, and the list goes on and on. She's also reportedly had uterine cancer, which has been argued by people in Gore World that was actually not cancer, might have just been precancerous cells that she exaggerated as being cancer, which is possible. At any rate, she got a hysterectomy and is cancer-free. It was during this era that her former partner, Beck, had to wipe her and care for her as she was recovering. I mention this because it kind of makes me more suspicious that Amberlynn Reid has Munchausen's. Not only is it believed that she exaggerated the cancer diagnosis, but the recovery was so lengthy for her that her former partner had to wipe her beyond any length of time that any normal person would be healed from such a surgery. And this was quite possibly because Amberlynn enjoyed having Beck take care of her to this degree. I truly believe that she really did enjoy making her former partner wipe her, care for her as if she were an invalid. And I say this because even to this day, when she's approached with this topic, she doesn't appear to exhibit any kind of shame or remorse. A normal human being would be ashamed of having to be wiped and bathed and cared for to that degree. But not Amberlynn. And there's something sadistic about that. Anyway, this leads me to the next part of this episode. And I want to discuss a story that Amberlynn Reid is famous for telling whenever she wants attention or to be seen as a hero or to get those feel-good, dopamine points. I'm talking about the time that Amberlynn supposedly rescued her little brother from being strangled on a curtain cord.
So I could still hear what was going on out in the living room. We lived in a tiny ass trailer. I was watching Roseanne. My brother started crying. Kept crying. Then it was a type of cry that I've never heard before. I went out there. He was purple, like on the verge of death because the curtain strings was wrapped around his neck. I was screaming at my parents, shaking them, and they wouldn't wake up. I had to save my brother's life. He was literally on the verge of death. And if it wasn't for me being there, he would have died.
According to Amber, it was sometime in 1999 while her parents were high on drugs, which is a theme to a lot of her childhood stories. I can relate. While her parents were strung out, her baby brother was supposed to be sleeping. He was by himself in his crib, and apparently she discovered that he was choking with the cord of the curtain by his crib wrapped around his throat. Amberlynn Reid has bragged countless times about being the hero in the story, saving her little brother's life, while her drug addict parents did nothing and laid unaware as to what could have happened. Now, if this story is even remotely true, and Amber's timeline is even remotely correct, then this would make her around 8 years old, and her little brother no more than just an infant, close to newborn. And if we know anything about Amber's background, we know that she was a neglected child who was quite possibly starving for attention, desperate for it, in fact. Now, I want to take a small segue to point out that sibling jealousy, when gone unchecked, can manifest into more severe issues, such as Munchausen Syndrome and Munchausen Syndrome by proxy. While sibling jealousy is a normal part of development, when it goes unchecked, especially in homes where there's already pre-existing negligence, especially where there's drug abuse and other forms of abuse, this form of jealousy can just keep brewing and brewing until the older child acts out in aggressive ways or attention-seeking ways and result to violence in order to get the attention that they feel that they're losing. This is where Munchausen's and Munchausen's by proxy can actually begin developing in childhood. The older sibling who's exhibiting this disorder may stage illnesses, stage accidents, or stage incidents in which their other sibling may be hurt, or where they may be hurt, or where there's illness shared between the two of them, or where one is sick or they're sick, all for the course of gaining that attention, whether it's to be seen as the savior, the good child, or a victim, or someone who needs sympathy. And just like an adult with Munchausen's and Munchausen's by proxy, a child exhibiting these behaviors might not even realize the true reasons why they're doing. So anyway, I don't want to make a direct accusation because that wouldn't be very nice, now would it? But I will say this. When Amber tells the story of how she rescued her little brother and saved him from choking, I am uneasy every time I hear it. How did an infant end up with a curtain cord wrapped around his neck enough times to be strangled in such a manner? And how convenient is it that young Amberlynn was just an earshot enough to know what was going on? And how fortunate that she was, because now she gets to be the hero of the story. So I want to know your thoughts. Do you think it's possible that Amberlynn Reid could actually have Munchausen syndrome or even Munchausen syndrome by proxy? I want you to ponder on that for a little bit. And until next time, bye y'all.